It is 8:46 here. What you are taking a look at right here, this is the EyeBOX. Inside this device, this is groundbreaking new technology to detect concussions, only available in 2 places in the country, and we are about to demonstrate how this works right here in our studio. Dr. Ron Elfenbein of Chesapeake Urgent Care in Gambrills is here to walk us through the process, along, of course, with our test subject here. You might recognize this face here. We have Ron Bateman joining us as well. Thanks for coming in, gentlemen. We appreciate this. This is a truly incredible experience and a very unique thing to have here in our studio. When did this become even available?
So it was actually FDA approved at the end of December.
Okay.
So it's brand new technology. They've been working on this for years. It's really a fascinating piece of equipment.
And fortunately for us today, you're going to walk us through how that works. We're pretty lucky. Mr. Bateman, you're ready for this.
I'm ready.
Okay, so as the patient comes in, what's the first thing?
Well, the first thing would be I would examine him and do the usual kind of concussion workup, you know, finger to nose and do all the looking at his eyes and all the rest of that stuff that we would normally do is just sort of to examine the patient.
Right.
The next thing is I would have him make himself comfortable. I'd adjust the settings for him, which we've done beforehand. So I'd ask him to put his chin in the chin cup. And you can actually pick up to, there's 20 movies you can pick from to watch. And
so he's going to watch a movie on this screen right here.
Yep, he's actually going to watch Finding Nemo.
Finding Nemo, that's what you chose.
So we're going to start. And
what is this going to do? As he's watching the movie, you know, how long does it take? How many minutes?
So in under 4 minutes, about 3.5 minutes, it will tell us whether or not he's suffered a concussion.
That's incredible.
And it's FDA approved for 5 years old up to 65 and up to a week out from your initial head trauma. Basically what it's doing is he's watching a movie that's moving around this screen right here. And it's tracking his eye movements.
Right.
And the computer is computing how his right and left pupil are tracking together, and as they diverge, it's computing that, and that's a bad sign when the pupils don't work together.
Ron, are you noticing any tracking in your eye? Does it feel like you're just normal?
He needs to ignore it.
Oh, he needs to ignore us at this point.
Sorry.
Okay, no, that's fine.
But no, all he's watching is a tiny little bit of the movie moving around the screen.
Right.
There's a really high frequency camera that's in this machine that is tracking his pupillary movements.
So this is so different from the normal concussion protocol. If you watch football, you hear them talking about that all the time, the normal concussion protocol. Why has this never been thought of before, do you think?
Well, it's been worked on for many years, and it just got FDA approval. So
it's been in the works.
It's been in the works, yeah. So the beauty of this thing is it's the world's first and only FDA approved, no baseline required.
Right.
So normally what would happen is if a collegiate athlete or a professional athlete, for example, they'd have to do a baseline test and then go through the testing again to determine, you know, whether they've suffered a concussion and when they can go back to playing sports.
How much more reliable would this be?
Very. And this obviates the need to do that. You don't have to do a baseline anymore. So no more baseline required. Kids playing soccer, they get kicked in the head, bring them right in, we can have it done in under 4 minutes.
That's incredible.
Yeah.
And I've got so many more questions. We're gonna come back to this because we want to see what his results are going to be. Again, he has to do this for 3 minutes. You're going to let us know what it shows, and then we'll talk about, you know, what happens if you do have a concussion, how long, you know, it might read that you do have one. So we're anxious to see these results. Thank you so much.
Thank you.
It is 8:55, and we are back now with Dr. Ron Elfenbein of Chesapeake Urgent Care to get some results from our EyeBOX concussion test that we just did here in studio. There are only 2 of these, not just in the country, but in the world. It took 3 minutes to do this test on Mr. Ron Bateman here is our test subject this morning. The results are in.
They are, and I'm going to show everybody what I'm looking at over here. You can see that.
Yeah. It comes up on that screen right there. It might be hard for them to zoom in on, but you can see exactly his results.
Yeah, so, you know, he did pretty well. Mr. Bateman, you've suffered a couple of concussions in the past, correct?
Yes, sir, I have.
So his number's a little bit high. So basically what this does is it computes what's called an EyeBOX score. And you can see these sort of pictures there that shows his eye movements across the camera for the course of that test that we just did. And he's tracked pretty well. His is a little bit high. Anything above 10 technically is positive. Anything below 10 is negative. In his case, my guess is that he's probably always going to be positive because he suffered multiple concussions in the past.
You said you did motocross, and
Yes,
you've gotten hit a couple of times.
Yes, ma'am.
But not recently.
2 years ago, I had a fall in a parking lot.
And you had long-standing problems from it. So that's probably why it's reading high. The beauty of this thing, though, is if it reads negative, The negative predictive value, meaning if it's negative, it's really negative, is like 97%. So if your kid gets hit in the head or something and you bring them in and it's negative, they can certainly go back to playing sports immediately.
That's incredible. Now, let's say a kid would come in, someone who hasn't done motocross for so many years. They come in, they have a positive. How long would it normally take if this is the first or second time that they've had a concussion for it to read back to normal? And does it ever read normal?
So that's a great question. It might read normal. Presumably, if it's their first time, it would go back to normal. What we would do is our protocol is to have them come back in every couple days and retest them. And then once it goes back to normal and they're free of symptoms, we would clear them to go back to playing sports.
This seems so amazing because you hear in sports so often that people are cleared too soon and then they suffer an injury that can unfortunately be deadly.
Yeah, well, the one thing I would like the viewers to kind of take home is that if a child's playing sports and they get hit in the head and you suspect a concussion, the most important thing is get them off the field. Do not let them play again because they can be devastating neurologically. If they get hit a second time after that first trauma without getting a chance to heal, they can have serious neurologic consequences for their entire life.
Wow.
So get them off the field, get them tested, bring them to see us. We'll get them through the EyeBOX, we'll get them tested, and in under 3.5 minutes, you'll have your answer.
I know there are only 2 of these in the world right now. How difficult is it to get an appointment and come in and get tested on this?
We're open 7 days a week, 8 a.m. to 8 p.m. You just walk in. You certainly can call us, or you can just walk in, www.chesapeakeurgentcare, spelled E-R-G-E-N-T, care.com. 410-721-2333 is our phone number.
And you're trying to get a lot of people because this is new and you want to, use it. And
we're actually part of a research study. So all the data that we're doing, the test is free. The visit, obviously, the insurance would cover, but the test is free. We offer the EyeBOX for free to people, and we're trying to gather as much data as possible for this research study.
Dr. Elfenbein, thank you so much. And how was Finding Nemo? Did you enjoy it?
Great.
We'll let you get back to that. Thank you for coming in.
Thank you very much.
Appreciate it as always.
Thank you.
Thank you.